The purpose of this lecture is to provide foundation material for the concepts associated with exercise metabolism. The key learning objective is to understand the concepts associated with total daily energy expenditure and how to apply this measure to an exercising individual. During this lecture, you will be given the opportunity to complete a series of self-test questions to assess your understanding of key concepts. Your responses to these self-test questions will not be included in your semester grade. We will start with an overview of what we will discuss in today's lecture. The total daily energy expenditure is composed of basal metabolic rate, the thermic effect of feeding, and any daily physical activity that you do. We will also discuss two methods of calorimetry that can be used to assess metabolic responses at rest and during exercise. These include direct calorimetry that relies on the measurement of body heat production, and indirect calorimetry that relies on the measurement of oxygen consumption using a metabolic cart. Calculated calorimetry relies on a secondary measure validated against either direct or indirect calorimetry. The use of accelerometers is a good example of calculated calorimetry. This pie chart demonstrates how your total energy expenditure, or EE, is broken down. About 60 to 75% of your daily EE is accounted for by your basal metabolic rate. 15 to 30% is accounted for by exercise that you do during the day. And it's important to note that exercise can be either formal or informal. The remaining 10% of your daily energy expenditure is accounted for by the thermic effect of feeding. The thermic effect of feeding is a normal biological process whereby you eat food and the physical digestion of that food requires ATP. The basal metabolic rate is defined as the rate of energy expenditure under standardized conditions. These conditions include lying in a supine position on your back, immediately after rising in the morning, and following a 12 to 18 hour fast. The basal metabolic rate, or BMR, is always lower in women compared to men due to gender differences in skeletal muscle mass. The key physiologic determinant affecting the quantity of skeletal muscle mass is the circulating concentration of the androgen hormone testosterone. Testosterone is present in high quantities in men under the age of 50 and declines with age. The BMR is always lower in older compared to younger individuals if all other factors, for instance, gender, physical activity status, etc., are the same. The BMR declines with increased age due to a reduction in the efficiency of metabolic ATP production and an age-associated decline in muscle mass. Previously in bioenergetics, I indicated that the body is at most 20% efficient at extracting energy from food and converting it into ATP. With an increase in age, you can see a decline in efficiency to less than 10%, which represents a 50% decline in the basal metabolic rate. To put this another way, if a 20-year-old woman has a BMR of 1,500 kilocalories per day, and they experience a 50% reduction in BMR with age, their BMR would decline to approximately 750 kilocalories per day. With this magnitude of decline, if the subject in question did not change their eating behaviors, then they would be likely to have excess weight gain as they aged. The fourth factor influencing BMR is someone's exercise training status. In general, individuals who are aerobically trained tend to have a higher BMR at rest compared to physically inactive individuals. This effect results in a higher resting energy expenditure that must be balanced by the establishment of sound eating behaviors in order to maintain body weight. It is not uncommon for highly fit aerobic athletes, for instance marathon runners and cyclists, to have a BMR in excess of 2,500 kilocalories per day. The BMR can be influenced by one's dietary patterns. For example, it is well known that reduced calorie dieting in the absence of physical activity results in a reduced BMR. This is actually a protective mechanism by the body, but is one that limits weight loss during dieting if the diet does not include regular physical activity in the plan. As discussed previously, according to the laws of thermodynamics, a significant quantity of energy in food, about 70 to 80% depending on one's metabolic efficiency, is lost as heat. This heat loss can be measured and used as an index of metabolic rate. Scientifically, it is far easier to measure body heat changes than it would be to measure the actual rate of ATP production. The good news is that the rate of heat and ATP production are proportional to one another. Direct calorimetry is an effective measurement technique that was developed more than a century ago. With direct calorimetry, an individual is asked to exercise in a sealed chamber that precisely measures changes in body temperature. The rate of change in body temperature is proportional to the rate of production of ATP. While direct calorimetry is an effective measurement, it is not always practical because it requires bulky equipment that is not always well suited for all locations or circumstances that one might want to exercise in. The major advantage of direct calorimetry is that it is effective for measuring both aerobic and anaerobic ATP production at the same time. A major limitation is that you cannot separate aerobic from anaerobic production of ATP. Given the limitations of direct measures, an accepted alternative is to use indirect calorimetry. Indirect calorimetry involves the measure of a byproduct associated with either aerobic or anaerobic production of ATP. The most common indirect measure used for aerobic ATP production is oxygen consumption. From bioenergetics, you know that oxygen is critical to aerobic ATP production, regardless if your body is using fat or carbohydrate to make ATP. Oxygen consumption can be easily measured in the field or laboratory setting using a metabolic cart. The most common indirect measure used for anaerobic ATP production is blood lactate concentration. Blood lactate concentration can be easily measured by taking a small fingerstick blood sample during exercise. A third method for completing calorimetry that has become increasingly popular in the last decade involves the use of accelerometers or step counters. Of these two tools, a 3-axis accelerometer is generally accepted to provide more accurate data than a pedometer. A major advantage of accelerometers is that they are light, portable, and relatively inexpensive. This means that a subject could wear the accelerometer for multiple days, generating a unique profile of their daily behaviors and exercise patterns. A limitation of accelerometers is that they are not a direct measure of energy expenditure and must be calibrated against a validated measure, for example, oxygen consumption. Many studies fail to properly calibrate their accelerometers, resulting in questionable data output. Now we will examine the various methods for measuring oxygen consumption in more detail. This diagram shows the setup for a standard whole-body calorimeter that would be used to measure an exercising individual. The key to this technique is the measurement of whole-body heat production. From bioenergetics, you should remember that the body is only about 20% efficient at making ATP, and the remaining 70 to 80% is lost as heat. And again, this is based on the first law of thermodynamics. You should note how the change in heat is being measured through the heating and cooling of water that is circulated around the chamber. This picture demonstrates the setup for a peak oxygen consumption test in our laboratory. This setup is for a cycle-based test. Please note the key components of testing, including the specialized bike, the computer which controls the bike, and the breathing tube which connects the subject to the metabolic cart. It is important to note that there are many other exercise modes that can be used to complete a peak oxygen consumption test. Some of these modes include treadmill running or swimming. Compared to cycling, treadmill running typically returns a peak oxygen consumption, which is about 10% higher. This picture demonstrates the performance of a peak oxygen consumption test using the same cycle ergometer demonstrated on the previous slide. You should note the position of the subject as well as the expert test administrator. This is the individual who carefully monitors the subject's physiological condition. You should also note the presence of the mouthpiece, which channels expired respiratory gas through the tube into the metabolic cart for the determination of oxygen consumption. Many different types of individuals can monitor exercise testing. In this case, Dr. McFarland is a professor with over 10 years' experience performing exercise testing. Also, the American College of Sports Medicine, or ACSM, offers certifications to BS and MS degree holders that allow them to perform exercise testing. According to the standards established by the ACSM, if a subject is deemed to be apparently healthy based on their medical history, then an exercise test can be performed without a medical doctor present. If the subject is deemed to be at risk, then a medical doctor should be present for all phases of testing. Subjects who participate in our research typically get a free VO2 peak test. If you had this done at a private gym, it could cost you as much as $400. So, participating in a research study is a great way to have this test done for free. As described on previous slides, VO2 peak tests can be completed using a variety of exercise modes. The image on the left depicts an individual completing a VO2 peak test on a treadmill. While the analysis equipment differs from what I have shown previously, the overall outcome is the same. Air that the subject breathes out is channeled into a metabolic cart for analysis. The expert test administrator is still present to monitor the subject. The image on the right depicts a swimming treadmill, also known as a swimming flume. This particular flume is located at the USA Olympic Training Center in Colorado Springs. Swimming flumes are useful as a training tool because they allow the swimmer to remain in a relatively stationary position. This particular flume also has a glass wall where the subject's biomechanics can be recorded for later analysis by a coach or trainer. This table highlights the fitness categories for a given VO2 value for men at specific ages. In order to maintain a healthy body, most men should strive for their aerobic fitness level to be between good and average. Individuals who fall into the excellent category train at a very high level. This is typically where most professional runners, cyclists, and triathletes fall. It is also important to note that individuals whose VO2 is less than 20 mL per kg minute will experience a significant impairment of normal functional capacity or activities of daily living. This table is fitness ratings for women at specific ages. You should note that the VO2 values for women at a given age are slightly lower than men. The gender difference in aerobic fitness is accounted for by gender differences in muscle mass. Men have the androgen hormone testosterone, which is a potent builder of muscle mass, explaining why men tend to have more muscle. Since skeletal muscle is the primary site of oxygen utilization, this explains the gender difference in oxygen consumption. In order to maintain a healthy body, most women should strive for their aerobic fitness level to be between good and average for their age. Individuals who fall into the excellent category train at a very high level. This is typically where most professional runners, cyclists, and triathletes fall. It is also important to remember that similar to men, if the VO2 falls below 20 mL per kg minute, then normal functional capacity will be diminished. You do not necessarily need to memorize these tables. However, you should be familiar with the physiological qualities of individuals that fall into different fitness categories. This concludes your Foundation to Exercise Metabolism. The information presented in this lecture was meant to prepare you for advanced information that will be presented during the in-class Exercise Metabolism lecture. Make sure and complete the Exercise Metabolism quiz prior to the in-class lecture. Please post any content-related questions you have in the discussion forum on Blackboard.